Peyronie's disease is a condition which leads to an abnormal curvature of the penis, which prevents satisfactory intercourse for either the patient or the partner. The exact causes of Peyronie's disease are not clearly understood. However, we believe that this may be related to microtrauma to the penis, as well as abnormal healing that leads to an inordinate amount of scar tissue and subsequently leads to a curvature of the penis. Peyronie's disease may lead to inadequate erections or erections with a significant amount of curvature that prevents penetrative intercourse. The diagnosis of Peyronie's disease is often self-reported. The patient may either present a picture, or we may consider performing an artificial erection in clinic in order to determine the severity of the curvature. Ultimately, if the curvature is severe enough to affect a patient's ability to have intercourse or satisfaction with their partner, then it may warrant an intervention. There are multiple treatment options for Peyronie's disease, with some being much more invasive than others. To begin, we can try traction devices to try to stretch out the scar tissue and see if that corrects the curvature to a certain degree. If that does not work, then there are injectable medications that can be performed in clinic in order to break up the scar tissue as well. Lastly, there are surgical options, which may range from placing simple sutures to counteract the curvature that is causing the penis to curve in one direction. In addition, a penile prosthesis may be a good option for patients who are suffering from both Peyronie's disease and erectile dysfunction at the same time. Lastly, there can be scar incisions and grafting that can be performed as well. You and I will work very closely to determine what the appropriate intervention for Peyronie's disease may be for you. It depends on the severity of the symptoms, as well as any concomitant symptoms such as erectile dysfunction, which may warrant a different modality of treatment. These will be based on the physical exam, as well as possibly performing an artificial erection in clinic in order to determine the severity and subsequent interventions for your symptoms. Peyronie's can be a distressing condition for some men, especially depending on the severity of the condition. Not treating Peyronie's can lead to unsatisfactory intercourse and sexual health for both the patient and the partner. In addition, if it's not treated, it can lead to persistent microtrauma to the area and lead to worsening curvature of the penis.